Right. Welcome to Shrinks on Tap. Pull up a chair, grab a drink, and let's talk. My name is Dr. Lauren Fisher, and this is
Dr. Eleni Boosalis.
and we're holistic and psychedelic therapists and the co-owners of Delray Psych and Wellness and the Wellness Junction. This episode is about ketamine-assisted psychotherapy, and this is for anyone who's feeling stuck in their lives. Okay, but before we delve into that topic, we're going to talk about our drink of the day. Go for it.
Okay, so our drink for the day is Little Saints mushroom drinks. These are non-alcoholic, non-intoxicating, pre-mixed mocktails, and they enhance connection, relaxation. They have reishi mushroom in them, only 5 calories, no sugar. So we're going to have one of these. There's spicy margarita, there is Paloma, ginger mule, and Negroni spritzer.
All right, super. Pour me one, Eleni. Yeah, so stuckness. Who hasn't felt stuck in their life at one point or another?
Right? That's like whether you're in therapy or in life or whatever, everybody feels stuck at some.
Yeah, and sometimes we just hit these roadblocks and we want clarity. So, in particular, today, as mentioned, we're psychedelic therapists, and for the last 3 years, we have been doing ketamine assisted psychotherapy. Psychedelic therapy is getting very popular in social, mainstream media. So, we do want to tell you a little bit about the foundation, but then also, why we got into it and why we think it has so much value, like what we've been seeing over these 3 years. Because you can learn and study things, but when you see it in action, boy, oh boy, like it has been a game changer for us personally and professionally. So let's start with
How we got into this?
yeah,
Well, maybe we should also tell you what it is. For those of you who don't like, what is ketamine, right? So ketamine is an anesthetic. It is actually the most widely used anesthetic in the world. The World Health Organization considers it an essential medicine. And so it's been used for pain management, for anesthesia, for depression, for surgery, all different things like that. So the safety the safety profile of it is there. So now we have discovered in the last 20 plus years that it has benefits for trauma work and depression and anxiety. So it is safe. It works on the glutamate neurotransmitter, which means you don't have to go off of your antidepressants to take it. And yeah, there's a lot of research, 50 years of research to back it up.
right. And some of you may also have heard, oh, that's a special K used in the clubs, the horse tranquilizer, and all that is true. But as you mentioned, in a medicinal, setting, it's been anesthetic. But in the last 20 years, it's shown to have all these other benefits, and in particular, integrated with therapy in the last few years has been shown to have profound changes for people.
For depression, trauma, anxiety.
Yeah, and some of the reasons is because the medicines are traditionally being used for depression, so SRIs, and other meds. Only like 40 to 50% of them are working for people or working to a point. So I always say, man, we've never had more therapy and more medicine, and people are still feeling as sick as ever. So the beauty about ketamine is that, as you mentioned, it's working on the glutamate system. It's a different part of your brain. And what's that responsible for?
So one of the things glutamate is responsible for is information processing. So if you think about it, whenever we are stuck in trauma or stuck in our thought patterns, stuck in our behavioral patterns, and you know what you're supposed to do, but you just can't get there. So glutamate is one of the things that's responsible for processing information. It also increases neuroplasticity in the brain, which means that you are able to create new habits, new patterns, new behaviors with less resistance. So the analogy I like to use when I'm describing what ketamine does to your brain is it's kind of like when you have a behavior, you've been walking down a forest the same way day after day, and that pathway is so open for you, it's easy to keep going down the same one. And when you try to create a new behavior, it's kind of like walking through a forest that nobody has walked through ever. So there's a lot of resistance. It's difficult. There's no path laid out for you. That is why people have such a hard time making behavioral changes or changes in their thought patterns. So when you introduce ketamine into that, and then ketamine has this ability to increase neuroplasticity, neuroconnectivity for 7 to 10 days, then people are much more likely or much less resistance able to make changes in their life. So that's that part. Then glutamate is also responsible for, well, there's so many different things, right? Like your autobiographical memory goes down, which means these stories we tell about ourselves.
which could be positive or negative.
Yeah.
Self-critical thoughts.
Self-critical thinking. Then there's also creativity is enhanced. So you have like a different perspective on life. There's just different parts of your brain that are open.
And they call it perspective medicine, like the things that seem so big. It's like you span out and it hits on the spatial awareness for you to like really put that in context and be able to move on from it. And another thing that's really important is internal sense of self in your working models. Like we develop like positive or negative senses of ourselves, others, in the world as we're growing up. So if you've had trauma, that's been disrupted. So a lot of people have anxiety or avoidance. That's where you feel stuck or you're kind of hypervigilant. So it can really restore a sense of safety and connection. And for some people, they haven't felt that their entire life, and they're feeling it for the first time in, okay, I'm getting us out of ourselves. But what's been so exciting about this, but it's so exciting to see people from the freedom of, just feeling intense anxiety their whole life or depression. So yeah, so many good things, but I just want to hit on one more thing before we get into like how some of us got into psychedelics before we did psychedelic therapy. The other thing is that I'm totally losing my train of thought right now. Oh, just the neuroplasticity. So, I mean, medical model alone and all the research is really robust on how it drops symptoms, right? Reduction in depression, anxiety, PTSD, but therapy helps you maximize that change in that neuroplastic window that you mentioned. That's the magic combination where like change in our belief really, really happens, long-term change. All right. So that's a little bit about it. If it's new to you, if not, welcome. Ketamine's a cool thing. So let's talk about how psychedelics ever got interested.
So interesting. So I lived in Miami in 1999, South Beach. I was a bartender, and everybody and their mother was doing MDMA. It was like, I mean, literally, it felt like everybody was doing MDMA. And I got so interested in MDMA that I ended up doing my dissertation.
Are you also saying that's ecstasy now, Molly?
Yeah. That is now called Molly, ecstasy. Yeah, at the time it was called E, or X. It's had all these different names. So I would see people, and I was a doctoral student. It was my first year being a doctoral student. And I would watch people, and they would have these spontaneous healing experiences, like while they were taking MDMA. So while we talk about the importance of setting intention with any medicine that you take, people weren't necessarily taking this medicine at the time for intention setting. They were taking it for recreational uses. But I would see the spontaneous healing happening. And
wait, I don't know this story. This is so cool. Like, what did you see?
So there's one story I have of a really good friend of mine she has never done any drug in her life. She was in her 20s, not smoked weed, was not a big drinker, like nothing. And she had just lost her mother, and tragically, and so she was going through depression. And I said to her, I think this would help. And she trusted me. And so she was like, okay, I'll try it. So she did it. So we went out dancing. And she came back that night after dancing for 4 or 5 hours. And she said, I finally can accept and process the death of my mother. And, cried and hugged me. And we hadn't talked about it. We hadn't done therapy about it. Like, it was just this realization, this connectedness to everything that is, and this release of grief. And you will say, oh, that's just momentary, it'll go back the next day. No, it didn't. She, like a year, 2 years, 3 years later, and she never did it again. It was one time. And that's what the research with MDMA was showing too, is these research studies that were happening at the time and are still happening today The protocol is, just a few times per year, 3, 4, 5 times per year. That's it. And the depression or the PTSD is subsiding long term. So I would see these things. And also, I experienced it myself. I was doing it and I was going through the experience of living in Miami at 22. My parents were like, why are you going there? Stay here. Just having this traditional Greek household where you don't do that. You do not move out until you're married and 40. Like, you just don't do that.
Not a thing.
Not a thing. So I'm going through my own self-exploration and individuation. And so, just having these deep realizations and healing experiences. So that to say, I got interested in MDMA, and then I did my dissertation on MDMA. And fast forward, and at the time it was hard to find an editor or a chair person in my department for my dissertation because they said you're promoting drug use. And I was like, I'm promoting this because I see that there's a lot of research to support it, and I can see that it gets people to a place where therapy can't alone. But it's illegal, even though there are studies all over the country and the world going on. So I kind of let it go. So I wrote my dissertation in 2005. And then we let it go. And then, our story, if you listen to our first podcast, Lauren and I went into traditional psychotherapy. We opened our private practice. And then, introducing different healing modalities, hypnosis, EMDR, Reiki energy work, all of the different modalities. And then 3 years ago, we stumbled upon a ketamine-assisted psychotherapy training. So that's what happened.
Yeah. Well, wow. So many thoughts. But I think, being a child of the 80s, say no to drugs. I grew up in a different way, fear of loss of control, more type A, never did any drugs. And I remember you saying you did MDMA as your dissertation. I was just like, all right, I don't really know what that means. I didn't even take a thought to think about it. But then a couple of years ago, when you started bringing it up, I became a little more curious because at the same time as you talked about how we transformed and evolved over time to become trauma therapists, and we're always looking, what's the next thing that's going to help heal? One thing I've learned and have seen is that therapy is really hard. Trauma therapy is even harder because it requires you to tolerate a certain level of emotion, right? And I think half the problem is that, a lot of people aren't trained in trauma. So people go into therapy and they get overwhelmed or they feel that, discomfort and they don't go back again. And so in trauma therapy, there's a lot of training to tolerate emotion, to be able, but it's still really hard work. And there's all this other stuff that gets in the way. So I say that because I had a couple clients that I was doing EMDR with, and they'd come in and we'd get to a point, and EMDR is an extremely effective technique. But what would happen is in between the session, I had no idea the client was doing this. They were using a certain strain of THC, and they came back and they're like, you know what? I sat down and I decided that I was going to take THC and I was going to revisit my, younger child, the person that was holding the pain of the past. And they did all this work. And I was like, you did what? And without any guidance, they did it. And he was like, it made sense to me. I got perspective. I changed the way I was thinking. I felt like that part was healed. And I was like, say what? And so it got me curious because I was like, you're using the medicine in a very intentional way. So when you brought it up, I'm like, yeah, what the hell? Let's see,
Try it. Yeah. Yeah. So we did a 6-month training. Then we did an experiential training where we did the ketamine twice with a group. And it was just mind-blowing. Right?
Mind-blowing. I also want to say, I thought it was like a didactic training. I had my book and ready, and it's like, welcome to the Portal Center. And I was like, what is this? Which, by the way, we were trained by Polaris Institute, and we have to give a shout out to them because they shaped the way that we do ketamine therapy. Everyone does it a little bit differently, but it was a beautiful training and healing.
Yeah.
So yeah. Anyway, but then we're like, well, it worked for us. Is it going to work for other people? And we're like, let's just do it. And wow.
So we started doing it. And, one of the things that we talk about when we said the surprising things that we encountered with using CAP with our clients is this idea of the inner healing intelligence. So, a lot of times we give power over to the medical provider for healing, right? And really a lot of it is in your body. Like you cut yourself, it heals. Even childbirth, you can birth a child most of the time by yourself, but there's this teaching in in the Western way is that you need the medical professional to guide you and to heal you. But really, when people have these deep healing experiences, it's their inner healing intelligence that's coming up. And so we found that when people were doing ketamine, they were dropping into that. And we were just sitting and supporting them and holding space and helping them feel safe and witnessed. But really, they were healing themselves.
Yes.
So that was one of the really amazing things that we witnessed, which really, if you think about it, that's what meditating and mindfulness is. It's just like observing your inner healer, dropping into yourself.
Yeah, and I think it speaks to that self energy. A lot of people think they're broken, and we're like, no, we don't like that. You're not broken. We're born whole, but then we get disconnected from ourselves and others through different experiences and trauma. So it's a restoration to whole. And I think within that, right? We talk about the self energy of right, and some may call it intuition, right? Your wiser mind, higher self, but that's the part that knows the truth about you, who you really are, and that's what gets tapped into, that inner healer, because it shuts down all that thinking brain, all those voices in your head. And yes, folks, we have a lot of voices in our head. Doesn't mean that we have multiple personality disorder, dissociative identity disorder. We have lots of different parts, but many of us can't get through that. And those parts, that's a whole nother episode. They play lots of roles, but it shuts the thinking brain down for us to access our truth, right?
Yeah, our true
and our inner healing. So that's what's kind of cool. I feel like we get to be much more of a guide and facilitator here.
Yeah, and then, we do that in one-on-one sessions, and we also do that in group sessions.
Yeah.
And the beauty of group sessions is this, we are traumatized in community and we with others, and we also heal in community with others. So there's this power to being witnessed by other people. There's power to being witnessed and held and felt safe that happens in therapy, but even more so within the ketamine room, right? Within the ketamine experience. And, also I want to say that there's this spiritual component to it.
Yeah.
Because we keep saying we're holistic therapists. What does that mean? So, of course, a lot of therapists, they talk about the mind, right? Mind and feeling. But there's the spirit too. There's a spiritual connection, and people don't understand what that is, right? And so when you're taking a psychedelic like ketamine, it opens that part up. And so when you have that feeling of interconnectedness with everything and everyone around you and everything that is, it's such a deeper healing. And that's one of the biggest predictors of long-term healing with psychedelics, is this ability to have this spiritual connection that people have oftentimes.
They don't feel so alone anymore.
Yeah. And you see how I'm connected to you and you're connected to me, and there's a deeper meaning to everything that we're doing. People are so stuck in their heads, and they're talking about he did that to me and she said that to me and he offended me and that was disrespectful. They get caught up in this whole story. Right. And they're not really just get under there, get beneath all of that and figure out what are you really upset about? Are you upset because you felt invisible because your parents weren't there for you?
Yeah.
What are you really upset about? Are you upset because you were abandoned by your partner the way your parents abandoned you? What is it? And so I think it just gives you this ability to get under there and look at what the deeper meaning is, rather than staying up here in the surface, which is what a lot of therapy does sometimes, of talking about a whole lot of bullshit that doesn't matter, right?
What'd you say, wall of words the other day? Wall of words.
People just talk and talk and talk and talk and talk and talk and talk. And it's just a wall of words. Nothing is actually being said.
Right. And it's not conscious. They have all these protectors, but it's you're not getting to the roots, right? And I think
Not
that
getting
is,
to the root.
and a lot of it's unconscious. We've also seen people come in and they always say, you can ask for what you want from ketamine, but it'll give you what you need. So often you think what you think is your healing is not what needs to be healed. And that's kind of beauty of like allowing the unconscious to come up to see what needs to be witnessed and attended to.
Yeah, you don't know how it's gonna show up. Again, you have to release control, like, go in with an intention
Yeah.
and then release the control. So
And that is like, just to speak a little bit about what a therapy session looks like. I mean, the difference between, if you go to a medical model infusion center, you're just going, you're getting hooked up to an infusion and you are receiving the medicine. And that is very helpful for symptom reduction. But in a therapeutic setting, what we are doing is that we are setting intentions, as you mentioned. And prior to that, we are doing relaxation and ritual and getting your mind and body prepped to drop out of your mind and into your body to receive the medicine and to allow what needs to come up. We use a blindfold. And the way that things can come up looks in a couple of different ways. It could be autobiographical, it could be imagery, it could just be somatic. But ultimately, like, you're making sense of that. What does that mean for me? And how that ties back to your goals for healing. And then we integrate that information a couple of days later. What was the takeaway and what does that mean for your life right now? Right.
yeah.
And
Yes.
it's really change.
Kind of like, why are we even talking about this, right? That we're talking about people who get stuck. And all of these stories we tell ourselves about, well, it should be like this or it should be like that. But it's like, what if you can be curious and you can admit that you don't know what you don't know?
Yeah.
And that this could be a possibility for you because there's so much just stigmatization regarding quote unquote drugs. But really, ketamine, if used in this intentional way, is a medicine. And same with MDMA, it's a medicine. And when people are like, oh, you're promoting drug use, I'm like, do you take diabetes medicine? Yes. Do you take medicine for cholesterol? Yes. Do you take depression medicine? Yes. Okay, so why can't we take ketamine for an alleviation of symptoms of depression? Like, why is that a drug? Like, there's such a stigma that people are stuck in that's why we wanted to talk about this, because you have to look at yourself introspectively and ask, why do you think what you think? Like, why are you so opposed to this? This could be something that will get you unstuck, right?
Yeah, totally.
So that's the point. Why are we stuck? And
Yeah, and if you are one of those people that you're like, hey, I've been in therapy 5, 10, 15 years, and you're like, all right, I know that I have trouble using my voice in a relationship because my father and mother was critical. You're like, I know this. I know why I can't speak up, but yet it hasn't changed. And a lot of times we're finding that people have just been doing talk therapy, and talk therapy is going to be effective to a point, okay? And I think that's a differentiation when your nervous system isn't changing, and that's why we evolved to mind-body. We're not saying you need to do psychedelics, but having somatic components part of a therapy process is really important in many cases. But this also just makes it a lot easier, too. And that's what people say. Like, they're like, I know all this stuff, especially so if you've been there, you've done also a lot of work, we find people are walking in and they do 2, 3 sessions and like, boom, like it just shifted for them. But you don't necessarily have had to do a whole lot of work either to have impacts.
yeah,
Everything's a process, but
some people just come in for one session
yeah.
to process something or release something or explore something. Yeah. And, and I had a conversation with this one lady at Burning Man this year, and she said, I don't believe in psychedelics. She goes, I'm a lifelong meditator. I've been meditating for 15 years and I get to that place on my own. And I'm like, of course you do, because we have an inner healing intelligence, right? So I'm not saying that you have to do something like this to get to that place. But at the same time, how many people do you know meditate every day for 15 years? No one. I can't even do it. I don't know anybody. So it's kind of, again, it's like, why are we so opposed to, why are some people so opposed to it?
And I know we're always like looking for the fast fix. I'm guilty of that too. But like, this is the right kind of fast fix, right? Because the quicker we heal for ourselves, the quicker we heal everyone around us and future generations. So like, why wouldn't we? And if you're following psychedelics at all, the research on psilocybin, MDMA, and like for everything, for combats, for alcohol, there's so much promise. Like this is the wave of the future, 100%. And guess what? You don't have to be dependent on medicine forever. It's like a medicine used for short
Right.
terms of highly impactful change.
That's the thing is most people are on SSRIs for years, right? But when people try these alternative medicines, it is not for years. It's short term. It gets you to next place. And that's it. You don't use these medicines for years and years.
Like, don't you think I'm way more chill since I've done some of my own ketamine therapy?
Oh, absolutely. You're like, whatever. If it works, it works. If it doesn't, it doesn't.
Yeah, I know. It's a good thing. Like, running the business and, being a little more the type A and worrying about things. And then it just like, I just immediately felt after that first week of just so much more chill, like so much more accepting, like focus on what's important and what's not. And I'm not saying that's all the time, but like for the most part, my nervous system has shifted and it made such a difference.
Yeah. And you also could say, well, I'll just do it at home alone, for example, right?
Yeah.
But like one of the differences with doing ketamine-assisted psychotherapy or CAP is that you go in with an intention, you go in with a sitter, you come out of it and you integrate your experience into your life. Like, how can I integrate this into my life moving forward so that it's not just like an experience isolated in and of itself, but it's an experience that will take me through my life and I can integrate what realizations and insights I had. So that's the difference between somebody saying, oh, I'll just do it by myself at home.
Yeah, well, I think the relationship back to surprises, there's a lot of things that have happened around the medicine that have been so surprising to me, like the relational healing, which sounds pretty straightforward. However, I say that because in the ketamine room, we get the luxury of being, in a different role than traditional therapy and to be like, hey, whatever you need right now, if you need us to hold your hand, if you need a blanket, whatever your needs are most important, this entire process where you feel safe, secure, and comfortable. And it's been interesting how many people are like, well, I wanted to ask for different music or this, but I was afraid to. And you're like, well, why were you? And they're like, I don't know. So it brings up all of this attachment stuff. So there's so much healing that happens just in this relationship of just being. Also, like for me, it's made me I think, a way better therapist because you also know you got to leave your shit outside the room when you go in a ketamine room because when people are open, they're going to absorb everything, all your energy, everything you say. So we take it very seriously. You need to because you're so influential in that state. Like, so you really have to be in a guiding, passive role, but your nervous system needs to be chill, right?
Yeah, as a sitter, as a therapist.
Yeah, so I mean, it's been like we benefit too. And that's where we're like all healing together, but when people tell me they're like, "Hey, I was in an infusion center and then all of this like discomfort came up." And I'm surprised. Listen, I always have to qualify because I feel bad. I don't want to talk bad about infusion centers. They have a lot of but they'll also just give you Xanax to like get rid of rid of the discomfort. Whereas in the therapeutic room, we're going to be like, okay, let's lean into that discomfort. What is that? Because when you lean into it and you have someone there supporting you, you're not afraid to do it. And that is going to tell you some information. You're going to process or release or get an insight that you didn't know. So we don't want to shy away. We want to feel into that.
Yeah. And that comes up a lot, this question of like, well, an infusion versus CAP. And what we say is an infusion is usually for someone who's just doing it for symptom reduction. They're just chronically depressed, treatment-resistant depression. They can't do work in therapy. Like, it's a symptom reduction.
And or super suicidal and at the end of your rope.
You're not there to do processing. Like, you're not doing psychotherapy while you're sitting in an infusion center. But with us, you're doing psychotherapy with the ketamine. That's the main difference.
Yeah. And sometimes people do infusions first and then come to the therapy. I will say, though, some of the other surprising things is like, I know you and I, we're open to like spirituality and all different types of things, but I really didn't expect in ketamine, like, the visitations from loved ones, regressions to past lives, all kinds of stuff happens, psychospiritual experiences. that I had heard happen, but it's been really phenomenal to kind of see happen
They
and
just
what
show
that
up.
means to people.
Yeah, and that's how they were saying about releasing the attachment to how it's going to happen. Because let's say they're coming in and they're like, I want to process my anger. Okay, and this thing that happened in my life, and then like their grandfather shows up, right? Because like,
Yeah.
oh, I didn't even think that it had anything to do with that. So you just have to release how it's going to show up.
Mm-hmm.
Yeah.
Yeah. Any last conclusions on this? I mean, I think you hit on how like we get to encompass like all of the modalities.
Yeah, I mean, the last thing I want to say is, over the last 20 years, we've learned so many different modalities like hypnosis, mindfulness, internal family system, we're doing parts work, EMDR, Reiki. And every time we're like, oh, yeah, this is where it's at. Oh, this is where it's at. And we just keep adding. And then all of a sudden we discovered CAP. We're like, oh, this is where all of it can live together because it just so easily incorporates all of those healing modalities. Yeah, so I think that was, like, another really surprising thing that we stumbled upon when we learned this way of healing.
And I mean, you probably can hear in our voices like how excited we are. I mean, I honestly was about to quit, scale back clinical work, and just focus on the business. There's plenty of business management. Just feeling burnout, and then we studied this and did our work and did it with people, and it's been so life-changing, and it's such an honor to do this work. That's the word that just gives it's like a privilege to sit in this deeper state of healing
Yeah.
with people. So that's why we want to share the word. But going back to stuckness, like we're not saying you got to do psychedelic therapy, but we do want you to be aware of it as possible consideration, but also just being aware and open to other things that might help you be unstuck. I think because we feel stuck sometimes, we're just like, oh, it's not going to change. And maybe it's essential oils, maybe it's acupuncture, maybe it's something different than you've done before, but just allow yourself to be open and to experiment because, what do the Buddhists say?
Oh, seek healing like your head is on fire.
Right. Well, they do say that. I was thinking the only constant is change, right? What not constant is change, or the only. But I think they both are relevant. We're suffering.
Every suffering, unavoidable. All of the things that Buddhists say.
Nothing like all those wise Buddhists. Yeah, like nothing lasts forever. So just remember there's some moment of stuckness and don't force it, but step back and just be like, what do I need? And let me just be open to what might help me shift.
Yeah,
So,
that's right.
yeah. All right.
So let's wrap up.
Yeah.
And thank you for joining us. And we will see you on the next episode.